A very good evening to one all present over here. Myself, Dr. Sheena, and I'll be dealing with the second part of dental materials, that is gypsum products and restorative resins. So before going into the topic gypsum products, it is very important to know what is gypsum. Gypsum is actually a yellow colored mineral which we extract from soil, and it is seen in various parts of the world, which is having a chemical formula of CaSO4.2H2O, that is calcium sulfate dihydrate. So from this gypsum, through the process of calcination, calcination means we will be heating this gypsum, that is CaSO4.2H2O with two water molecules, is being calcinated to form various gypsum products. So we know that what happens is like there is decrease in the amount of water from the normal gypsum, which leads to the formation of various gypsum products. So the various gypsum products are type 1, type 2, type 3, type 4, and type 5. How how it is different? What makes all these 5 gypsum products different? This is mainly because of the type of heat which we give, or the type of environment on which this heat is being given. How to memorize these types? Type 1, we know if when a patient comes to our clinic, we'll be taking the impression first. So we can memorize type 1 as impression plaster. Type 2 is model plaster, also called as plaster of Paris. So plaster of Paris is actually used for making the cast or for actually flasking, etc. Type 3 is dental stone. We know that we used to use in ortho and all for pouring the cast, that is like green in color, dental stone. And it is also called as hydrocal and also called as class 1 stone. Please don't get confused with these both. The other is like type 1, type 2, type 3, type 4, type 5. Here we start with class 1, which is the type 3 dental stone, which is actually green in color 1. And type 4 is also called as class 1 to class 2 dental stone. From here, the dental stone is converted to improved dental stone, hydrocal to densite, and also called as high strength dental stone. The last one is high strength, high expansion dental stone. So it is very easy to memorize. Type 1 to type 5. Type 1 will be taking the impression. So it is impression plaster. Type 2 is which we use commonly plaster of Paris or the model plaster. Type 3 is called as a dental stone or also called as hydrocal, and there starts the classes, that is class 1 stone. Type 4 is the dental stone has been modified, also the high strength. Last one, high strength, high expansion type. So what is happening when we actually manufacture, what is happening when we actually heat calcium sulfate dihydrate, that is gypsum. So what happens when we actually heat gypsum? When we heat gypsum or calcination is done, there is two type of reactions or two type of products that is mainly formed, that is beta hemihydrate and alpha hemihydrate. So beta hemihydrate is actually the type 2, that is plaster of Paris, and alpha hemihydrate is actually the green color dental stone, that is type 3. So simple. So what happens, how type 2 is formed, how beta hemihydrate is formed? When we take this gypsum and we actually pour it in an open kettle with open air and heat it in 120 to 140 degrees Celsius, we'll get a product that is CaSO4.half H2O. All the formulas of all the products is same, but the process how we make, the process of calcination is different actually. So beta hemihydrate is the type 2, that is plaster of Paris, which we use, is actually produced in an open kettle in open air at a temperature of 120 to 140 degrees Celsius. So next is alpha hemihydrate, that is called as dental stone. That is the type 3 classification. It is done in a closed chamber. The first one we did, the beta was in actually open chamber in air, presence of air. Here it is in a closed chamber with steam pressure, right? Steam pressure, and you can see the crystal shape. That is another important thing. Beta hemihydrate, that the plaster of Paris which we use, is irregular in shape and it is more spongy and it is more porous. So means what? It is irregular, spongy and porous means whenever we apply water, it needs more of water. So that is the problem with type 2, the plaster of Paris, which we commonly use. See, beta hemihydrate particles absorb more water because the crystals are more irregular in shape and porous in character. So when compared to alpha hemihydrate, beta hemihydrate is irregular, which is spongy, and it is very much porous. When compared to the beta hemihydrate, alpha hemihydrate is very much dense. It is more of a prismatic type. It is non-spongy. It is more of irregular. It is non-porous. So this is the difference between the two type of calcination that take place. One is called as the dry calcination. This is called as a wet calcination. So beta hemihydrate is type 2 and type 3 is the alpha hemihydrate. Beta hemihydrate, open kettle, presence of air. The other is dry or in the presence of steam or pressure. And beta hemihydrate, plaster of Paris, is very much spongy, porous. Okay, so that is a main important point that you need to memorize in this slide. Another important thing, so this is about type 2 and type 3. So how type 4 and type 5 is formed? When we actually do the same procedure which we have done in alpha hemihydrate production, that is the usage of CaSO4.2H2O in a kettle at a closed chamber with a steam pressure, along with the use of CaCl2, that is 30% of CaCl2, it leads to the formation of type 4 and type 5 gypsum product. Understood? So this is the basic mechanism how which the various products are formed. You can see all the products of gypsum have the same formula, CaSO4.12H2O, but the production is different. One is dry calcination, one is wet calcination. The final type 4 and type 5 is formed by a new material, that is 30% of CaCl2 is added, which leads to the formation of type 4 and type 5 gypsum product. And this is a chart that you need to memorize when you go for an exam and also you attend gypsum product questions. First of all, as the first slide have already been explained, that is the various types of gypsum products. Next, going to the compressive strength. The compressive strength is very easy to memorize. See, it is 800 and again it goes to 1300. From that, you just take the 3000, add a 2000, 5000, add a 2000, 7000. So that is a difference. Just think 8000 and it moves to like 8 to 13,000, 1300. From there, like take the 3000, 5000 and 7000. That is very easy to memorize. And you can see the last one is having a compressive strength of 7000. That itself shows it is very high improved quality material. That's why it is called as high strength, high expansion dental stone, right? Next important point is the water powder ratio. This is very important. Now you need to memorize what I told about beta and alpha hemihydrate. Beta hemihydrate was porous. That is a type 2 gypsum product. So it needs more of a water powder ratio. See, the gypsum type 2 is having more of a water powder ratio of 0.45 to 0.50. And after that, it decreases. 0.28 to 30, 0.22 to 24, 0.18 to 22. So type 2 is having more of a water powder ratio of 0.45 to 0.50. Just memorize that. Next is actually the setting expansion. It is also very easy to memorize through this chart. 15, just the double of that 30. Then 30 decreases by 10, 30, 20, 10. It is percentage, 30, 20, 10. And again to the same number as that of type 2. Just relate this and study. It is very easy. So first is the name that you need to memorize are the names. Next is the water powder ratio. You just memorize beta hemihydrate is having more of a porous structure, more of a water powder ratio. Next is the setting expansion. The first one is just half of the second one, 0.515. Just double 0.30. Just reduce by 10. 20, 10, and after that just the same as that of type 2, and after that the compressive strength. So this is the altogether briefing of the chart that is very important in gypsum product. Next is, as I said, the gypsum which we got from the nature is having a formula of CaSO4.2H2O. So what we did is like we heated it to produce all the gypsum products which we have in the market. So what happens when we take a plaster of Paris? The plaster of Paris which we take, to that we'll be pouring the water, we'll be mixing it, right? So the plaster of Paris is having a formula of CaSO4.2H2, that is CaSO4.half H2O. So what happens is like when we add water, there is the formation of gypsum, and it is an exothermic reaction where there is release of heat. This is a very important reaction. The gypsum product, where the conversion of it into gypsum is actually an exothermic reaction. So what is the amount of water required? This is very important portion, that the concept that you need to keep in mind. So think about the plaster of Paris which we use for actually pouring. We'll be pouring some water to mix and make it into a hard mass. So think about plaster of Paris which we take. We need to mix 100 gram of plaster of Paris. So 100 gram of plaster of Paris require 18.6 ml of water, right? We'll be taking plaster of Paris, 18.6 ml of water is used for actually mixing. This water that is required to form the set gypsum is called as water of crystallization. It is not possible to use this in clinical practice. Just think that taking 100 grams of plaster of Paris and putting 18.6 water and mixing means as soon as like we start mixing, it form a hard mass. We know that plaster of Paris have to flow into the cast or flow into the mold properly, so that it actually takes all the details within the cast. So if we mix like this, the proper setting, the proper thing which we need won't be getting. So always we need to increase the amount of water. There should be some excess water that have to be given, so that there is flow of the material. There is less viscous material which we'll get. So normally you need to think the water of crystallization, the complete set, it needs about 18.6 ml of water. So we need more water so that it is more flowable, so it can easily move into the mold. Now, a new concept came. For 100 gram of plaster of Paris, we need to add 45 ml of water. We know that 18.6 is the water of crystallization. Means the plaster of Paris will completely get dipped or completely takes 18.6 ml of water. See, like 45, the total water which we gave was 45. And inside that, 18.6 is taken by the plaster of Paris. 26.4 ml is remaining. So this is the remaining water that is actually present. So this is the remaining water that is present within the plaster of Paris after being set. Okay. And the strength which we get from the remaining water or the excess water in plaster of Paris is called as wet strength or green strength. So you need to memorize these values. For plaster of Paris, 45 ml of water is given. For type 1 and type 2, it is 45 ml. For type 3, it is 30 ml water given. For type 4, it is 20 ml water given. For all the products of this gypsum have water of crystallization of 18.6 ml. Hope you understood. So water of crystallization is the amount of water that is required for a plaster to set. But we cannot do this practice in clinics, because as soon as we give the right amount of water, it gets set into a complete hard mass. To avoid that, we give excess of water. So this excess of water is called as the wet quantity, or the strength which it provides is called as the wet strength or green strength. Okay. So you can see this question that was asked in the previous NEET MDS. Water of reaction needed to react completely with 100 gram of calcium sulfate hemihydrate to convert it into calcium sulfate dihydrate. See, the question is like, for 100 grams, what is the water that is needed for complete reaction? The question is given, it is not excess, it is complete. So we know that water of crystallization is 18.6 ml. So that is the answer. So next question, the product, just think and answer by yourself. The product which is obtained by calcining gypsum under steam. So it is steam. It is not an open kettle. If it was open kettle and open air, it would have been beta hemihydrate or the type 2 gypsum product or the plaster of Paris. So since it is under a very hard steam pressure of 120 to 130 degree, it is actually the alpha hemihydrate, right? The next question is beta hemihydrate calcination true is, which is the point is true in this? In presence of air, in absence of air, which is the answer? Beta hemihydrate, of course, in the presence of air. So that is the answer. Next is, according to the ADA specification, type 3 gypsum. So you need to think what was type 3. Type 3 comes the green color, that is dental stone. And so that is the answer, dental stone. Type 4 is high strength. Type 5 is high strength, high expansion type. Impression plaster is the first one. Think like first we'll be taking the impression, the type 1. And the answer is type 3 is dental stone. Green strength with reference to plaster means. Now you know, as I said, the excess water which is required for providing that strength is called as green strength. So inside this, it is a wet strength, not the dry strength, right? Hardness of stone surface is affected by. So this is one of the questions you need to correlate with the hydrocolloid impression material we have dealt on the last class. So hydrocolloids means it is agar or alginate, the impression material which we use. So agar is actually a reversible hydrocolloid, alginate is an irreversible hydrocolloid. So what happens is like when we use agar or alginate or we pour the hydrocolloid impression material into agar, what happens is like the agar consists of agar particles and also borax. So these two particles have a tendency to decrease the setting reaction of the stone which we pour. Hope you understood. The agar to which we will be actually pouring the stone. So agar consists of agar and also borax is there. These two substances have a tendency to retard or stop or decrease the setting of stone. So hardness of the stone is often affected by a hydrocolloid. None of the other impression material often affect the setting or hardness of a dental stone, right? Now we need to study some headings like accelerators and retarders, that is most commonly used question. So accelerators and retarders means these are actually substances which by adding we can actually enhance the setting reaction, the time of the setting reaction, and which we can actually retard or decrease the setting reaction. The first one is accelerator. So one of the question that was asked for NEET MDS was like, what is the use of accelerator and retarders, or which component is like being determined by accelerators and retarders? So the accelerators and retarders actually control the setting time. That is the main thing you need to keep in mind. So accelerators and retarders, they actually mainly control the setting time. So some of the accelerators are, that is which enhance the setting reaction is like K2SO4, that is potassium sulfate, sodium chloride, accelerate the setting reaction of gypsum product. So if we put a small amount of sodium chloride and K2SO4, there will be increase in the setting time. Next is powdered gypsum. Sometimes the gypsum product which we get, like the plaster of Paris or the dental stone, etc., consists of small amount of gypsum, that is the completely set CaSO4.2H2O. So what happens is like when we when there is the presence of CaSO4.2H2O, they act as a nuclei of crystallization. They act as a starter. This CaSO4.2H2O, which is already there in the powdered gypsum product which we get, act as a nucleus, and to that crystallization take place, and there will be very fast setting. So this is called as actually terra alba. Terra alba is actually a powdered gypsum to which actually consists of powdered like gypsum on which the gypsum product is actually present, it is called as actually terra alba. So these are actually the various portions which actually accelerate the setting time. Next is the retarder. You can memorize it by the code ABC. ABC is acetate, B is borate. Borate and borax are the same thing which is actually seen in hydrocolloid agar, which also inhibit the setting reaction of gypsum. C is citrate and chloride. The other you need to like memorize like glue, gelatin, gums, and a small concentration of high concentration of sodium chloride was actually the accelerator. Small concentration of sodium chloride, but when the concentration is increased, they act as a retarder. So this is a very important point. The question whenever asked, like you need to see the concentration, whether it is small concentration or high concentration. If the concentration is increased, that is sodium hypochlorite, it acts as a retarder. So just memorize it as A, B, C, that is acetate, borate, citrate and chlorides, and the other thing which we commonly use like the glue, gelatin, gums, etc. And the concentration of sodium hypochlorite, very important, right? So how these retarders actually inhibit the setting time? So what happens is like retarder generally act by forming an absorbed layer on the hemihydrate. We know that the plaster of Paris consists of hemihydrate. So onto the surface of that, they actually form an absorbed layer. So what happens is like there is no nuclei for the attachment of other calcium sulfate onto its surface. So there is no reaction taking place. So that is how they actually inhibit the growth of the crystals, right? The question, the function of 2% potassium sulfate in a gypsum product is. So we already know like it is actually a accelerator, and what is happening is like we already studied accelerators and also retarders often inhibit the setting time or regulate the setting time. So the answer is it will regulate the setting time. The next is we need to study the various method how we actually find out whether there have been a complete setting of the material, the gypsum product which we have done take place or not. How we actually find out the compressive strength, the time at which a material set, etc. These are various methods how we find out or how we evaluate the setting of the gypsum products. The first is the loss of gloss test. So we know that whenever we add water to calcium sulfate hemihydrate, it starts on absorbing the water. Initially, there will be a glow on its surface. As time passes, the glow will get lost. So the mix loses its glow, right? That is one method how we can actually say that there is loss of the there is initial set that I've taken. So I'm talking about the initial set. So initial loss of glow test is actually the initial set assessment method. Second is Gilmore. Actually, Gilmore is actually a machine with a weight on its surface. There is a Gilmore needle which is used. So think that this is the plaster of Paris, and onto that we will be actually applying the Gilmore needle load. The initial Gilmore needle test, we use a Gilmore needle of weight 113 gram weight. So this is actually initially used, and we will be actually applying on the surface of the gypsum product. If there is no indentation that is produced, it shows that the initial set have taken place. Hope you understand. Gilmore is actually a needle-based test. We'll be using a needle of weight 113 gram, and it is applied on the gypsum product which we use. And if there is no indentation produced on its surface, that means that the initial set have taken place. The next is we'll study about the final Gilmore test. Again, we'll be using the same Gilmore needle of a more weight of 453 gram. So the 453 gram is actually applied on the surface of the gypsum product which we use. Here you can see time at which the heavier Gilmore needle leaves only a barely, means a very small indentation like this, or a no indentation at all. It is actually called as the final Gilmore needle test. Hope you understood. So the initial Gilmore test actually indicate the initial set of plaster of Paris. Final Gilmore needle actually shows the final set of plaster of Paris. There is change in the weight from 113 gram to 453 gram. Next is we can't needle test that is also similar to that of Gilmore. There is a needle which is penetrating on the surface of the gypsum product, and by that we can assess the final set of POP. So this is actually from this also certain question have been asked, like which is the test that is used for assessing the setting of a gypsum product. All right. Next, very important thing is setting expansion. So we know that the gypsum product, since there is absorption of water taking place, there is certain hygroscopic expansion, that is water related expansion, and there is nuclear crystallization, that is from which there is growth of the crystals and pushing of the crystals taking place, and expansion take place. So there are various factors through which we can actually control the expansion. The factors that decrease there is setting expansion is like, see, beta hemihydrate. First of all, we know that beta hemihydrate is more porous, it is irregular in shape, so it needs more water, right? More water powder ratio is required, but it goes into the porous area, it cannot expand outside. So it is a logical question. Beta hemihydrate, it need more water powder, right? We have already studied is having like 40s to 50s water powder ratio is required because of the porous nature of the material. And what happens is the water goes into the porous area, it cannot push outside, causing a setting expansion. And next is the addition of certain modifiers. We have already studied it earlier, like K2SO4, borax, etc. actually helps as a modifiers in decreasing the setting expansion. Reduced spatulation. The spatulation means what happens is like, see, when we take a plaster of Paris, we keep on spatulating again and again. What happens is like, there is a nuclear crystallization which have formed before spatulation. When we mix it again, what happens is like, it get actually split in, and newer area of crystallization is actually formed. So faster setting reaction and setting expansion take place because of the crystal growth, right? More crystals are growing because more nuclear crystallization is actually taking place. So more the spatulation, more the setting expansion take place. If there is less spatulation, means the setting expansion won't take place because near nuclear crystallization is not taking place. Hope you understood. So just the opposite, alpha hemihydrate, because water is less. So what happens is like whenever we apply water, there it is regular shape. So inside its powder, water is not required much. So it will push outside, showing a setting expansion. And another important thing is allowing to set under water. So what happens is like whenever material is actually allowed, especially the gypsum product is allowed to set in water, there will be increased setting expansion taking place and increased rate of spatulation. So these are the important things that you need to memorize when we study gypsum product, because gypsum product is actually a very small area. And there are only few certain questions that is continuously being asked. If you get the concept, it is very easy to answer this. Gypsum, talking about gypsum is CaSO4.2H2O. From that, we got 5 gypsum products. And we have to know what are the names of type 1 to type 5. What is class 1 to class 3? Other names, very easy to study. It's compressive strength, the water powder ratio, the setting time. Now, what is the water that is required for mixing this? From that, we get water of crystallization. What is green strength? That is the excess water which is responsible for the strength of gypsum, that is called as green strength. And after that, we have to know the various test that is used for assessing the setting of plaster of Paris. And at last, we have to know the various factors like accelerators and these retarders, and also the expansion. So these are the main headings that is commonly been actually used, commonly been asked for the gypsum products. Hope you understood this topic very well. And keep on like reading this PPTs once more, like try to hear and also read the synopsis portion. You will get it very fast. So moving on to the next portion, restorative resins. So talking about the first resin, that is acrylic. We know that we are much familiar with acrylic resin. That is, we used to do the denture for patients and all. And not only acrylic resin, the other resins that are used for building the denture is like polystyrene, vinyl copolymer resin. So these three are actually the commonly used resin for actually building a denture. So why? We know that we commonly see acrylic resin. Why acrylic resin is most common? That is mainly because the acrylic resin consists of methyl methacrylate within that. The methyl methacrylate within that is actually transparent in nature. So what happens is like we can actually add various colorants or various tint to that so that we can mimic the oral cavity. That is why we are adding a pink tint to that. Because of that, it is often mimicking our oral cavity. That is one advantage of acrylic resin when compared to the other resins. Second is like it have a very good strength, especially it is required because a lot amount of occlusal forces is being built up when we do a CD, a complete denture on a dentulous patient. So there is a requirement of strength, which is a very important criteria when we use a resinous material. That is why when we compare all these resinous material, acrylic resin is the most commonly used resin for building up dentures. So as I said, normally the acrylic resin is made up of unpolymerized. This is a concept that you have to keep in mind. You need not mug up the various material, just understand the concept. Unpolymerized methyl methacrylate, very easy. MMA, methyl methacrylate. It is unpolymerized. When we actually do a denture, we get the final product. The final polymer product consists of polymethyl methacrylate, means multiple methyl methacrylate come together to form polymethyl methacrylate. How this is formed? By radicals. So there are free radicals that help in the conversion of the methyl methacrylate to polymethyl methacrylate. From where we will get this free radicals? You need to know what is initiator. Initiator is any substance which starts a chemical reaction is called as actually a initiator. So what happens is like benzyl peroxide is actually the agent that produce free radicals. Very simple. We need free radicals for the conversion of methyl methacrylate to polymethyl methacrylate. From where we get the free radical? It is from the benzyl peroxide. So benzyl peroxide is in an inactivate state inside that methyl methacrylate, powder. So from where they get activated, they need to be activated. Activation is done either by heat or either by the chemical or self-curing or auto reaction taking place. Hope you understood. Free radical is required. We get free radical from benzyl peroxide. This benzyl peroxide need to be get activated. For that, activation is by heat. Heat means we'll be actually applying in hot water, like we do the denture process. That is by the heat application, or it is by the chemical cure, which is commonly set by its own. Understood? So, of course, as I said earlier, in the case of the gypsum products, this is also an exothermic reaction. Once this reaction get completed, there is large amount of heat that is actually produced. It is an exothermic reaction. So some of the other name of as I said, chemical cures, which actually sets by its own, that is actually chemical cure. So chemical cure, then other names are cold curing, self-curing, auto-polymerizing resin. So how this activate? As I said earlier, heat activate benzyl peroxide. Benzyl peroxide give free radicals. There is conversion of the unpolymerized methyl methacrylate to polymerized methyl methacrylate. So how in the case of this self-curing resins? This reaction need to take place and we need free radicals. We need something called as benzyl peroxide from which free radicals are formed. How to activate benzyl peroxide? So there is something called as N,N-dimethyl p-toluene. So this is the thing that activate the benzyl peroxide. Thus, benzyl peroxide produces a free radical. The concept is very easy. Just keep in mind for it answering. So the first is heat activated. This is chemical activated. The chemical is N,N-dimethyl para-toluene that activate the benzyl peroxide. Benzyl peroxide actually, there is a release of free radicals that actually convert methyl methacrylate to polymethyl methacrylate. Hope you understand the difference between heat cured and chemically cured acrylic. So some of the things that you need to memorize in this chapter or this content is heat cured denture. Of course, it is available in powder and liquid, which we already know, which we used to use. It is always also available in gel form. And it is either having a tooth colored, that is the white transparent colored, or the pink colored material is there. Gel type is not that commonly used, but it is less used when compared to that of the commonly used powder liquid type. Next, very important thing is powder liquid ratio, powder liquid composition you need to know in. This is heat cured acrylic. First of all, the major component is MMA. The very important major component is MMA. The second is actually called as, so the question might be, which is a major component in the powder of a heat cured acrylic? So it is poly-MMA, right? And it has certain other MMAs, I mean MAs also, like methacrylate also, like ethyl MA, butyl MA, they are copolymers. That is, it is not up to the major level, but it is present in amount in the powder. Next is, as I said early in that reaction, we need an initiator, that is benzyl peroxide. We have already studied that in that reaction itself. And again, there is something called as plasticizer. So you can remember it is P, right? So it is like phthalate. Whenever you see which is a plasticizer, which is actually seen in heat cured resin, just think there's something related to P. P will be P. So it will be dibutyl phthalate. Okay, it is like dibutyl phthalate. Just remember at least the P for actually memorizing that it is the plasticizer. Next, this opacifier is always an oxide, OO, that is zinc oxide or titanium oxide. Next is like the dyes are there for actually giving that color and for actually giving a stiffness and all. Always you just think even composite or any material which we use, the filler particles will be mostly the silica related materials. Like in composite, the filler particles is silica. Similarly, whenever you see which is a material that give hardness or stiffness to a material is silica-based products like zirconium silicate or aluminum or glass-like products. That is the inorganic fillers. Hope you understood the powder. That is, first is a major component, MMA. Similarly to that, it consists of what? Ethyl and methyl MMA and benzyl peroxide. Benzyl peroxide we have already studied in this thing. It is an initiator. Plasticizer is actually P, phthalate. Opacifier is O, all the oxides. And inorganic fillers are silica. Now, the liquid also consists of methyl MA, that is MMA. The dibutyl phthalate, that is actually the plasticizer, already I said, PP. And another important thing is actually the hydroquinone. This is very important thing that you need to keep in mind. Hydroquinone. It is actually an inhibitor because sometimes, as I said, the acrylic powder get activated when we give heat. When we actually store the powder and liquid, and we know that our environment there is continuous change of temperature. So because of this temperature, sometimes the reaction might start within the bottle itself. To prevent the premature polymerization, the polymerization before which we need, we actually use something called as hydroquinone. So all these terms which I've used till now, the powder, the liquid, it is very important. Phthalate is plasticizer P. O oxide is opacifiers. Hydroquinone, that is our only name that is different, hydroquinone. It actually prevents the premature polymerization. Another important thing is glycol dimethacrylate. It is actually the cross-linking agent and reduce crazing. What happens is like the normal methyl methacrylate is actually it is actually a bifunction single functional unit. It have only a single functional unit. So when we add another MMA, it only links to a single unit of MMA. So whenever we see this molecule, it is like MMA, it is like this. So what this glycol dimethacrylate does is like, it is having another functional group. So the glycol MMA get more of like reaction to MMA. It helps in more cross-linking with the agent of MMAs. Rather than the MMAs going and like connecting to itself, there is a cross-linking agent or a hand in between them to actually hold all the MMAs and helps in actually a cross-linking agent. Also, they helps in actually reducing the craze lines or the fracture lines, etc., making that more of a strengthened product. So that was all about the important things in actually heat cure acrylic. Next is self-cure acrylic. What is the composition? Same as that of the heat cure, except one thing. We have already studied that for liquid, we are not providing any heat from outside for activating benzyl peroxide. So we need a chemical inside that is N-dimethyl paratoluidine, which we have actually already studied. That is the activator. It is also called as tertiary amine. That is very important. It is actually the tertiary amine. So tertiary amine is only seen in self-activated, because these are the self-activators that is required in a chemically activated acrylic powder. Hope you understood. Acrylic powder is of two types, heat cured and also light cured. So based on the composition and also based on the reaction, they are much different, and need to just memorize what is the what is the reaction taking place, and what are the different chemicals and different activators that is present. First question, in heat cured denture base acrylic resin, the monomer is. So we know that the main monomer is actually what? Methyl methacrylate. Of course, it is actually methyl methacrylate. It is methyl ethyl methacrylate. It is not the answer. If there was methyl methacrylate, of course, that is the answer. Ethyl methacrylate or methyl acrylate. Next is the defect that is actually seen. This is also another question commonly been seen in this chapter. So what are the porosities? There are two types of porosities. Internal porosities and external porosities, one. Second, crazing, and third is wrappage. The first is internal porosities and external porosities. So what is the difference between these both? Internal porosity means bubble that is actually seen within the acrylic portion, and they are mainly seen in the thicker portion. That is the main thing, especially in the palatal area of the denture base. In the thicker portion, this internal porosities are most commonly actually seen, and external porosities are actually seen on the external surface of the denture base. So what is the reason for internal porosity? The main reason is due to vaporization of monomer when temperature reach above 100 degrees Celsius is actually the reason that is responsible for internal porosity. Just think, porosity within inside is mainly because of the temperature above 100.8 degrees Celsius. And what happens for the external porosity? If we are not applying a proper external pressure or adequate pressure, that is the main reason for the external porosity. Hope you understood the two difference. The question was like, if curing occur at temperature more than 100 degrees Celsius, porosity results in which area of the denture? As I said, since it is more than 100 degrees Celsius, we have to keep in mind that it is internal porosity. The internal porosity mainly happens because of the temperature excess, and they mainly seen in the harder, thicker central area. Hope you understood. Next is what is crazing and what is wrappage. So crazing is actually the formation of surface crack on the denture basis, mainly because of the incorporation of water. That is very important thing. The craze lines or the crack lines is mainly because of the incorporation of water. And what is wrappage? Is the deformity or change of the denture which can affect the fit of the denture. Because sometimes when we actually apply onto the surface of this the denture, it might not be actually sitting properly. That is actually called as wrappage. Wrappage is mainly happening because of the various stages. Duff stage is there, rubbery stage is there. So packing during rubbery stage is actually the main reason. And if there is also stresses incorporated during flasking, if we are not properly actually putting the cast and the stress application, that is also the main reason for the wrappage. So these are the four important problems that often we see with the usage of acrylic powder. That is actually, first is the porosities, that is internal and external. Next is the crazing. Third is the wrappage. So the question is like, hydroquinone is added to methyl methacrylate monomer. This is the only thing which I haven't given any code. So this is actually, as I said, whenever bottle is kept separately, sometimes they have the tendency to actually start the polymerization. So the answer is to prevent polymerization during storage, hydroquinone, right? Cross-linking in denture base is contributed to, as I said, which is a material cross-linking. You can remember it as C is equal to, it is like G, right? So it is glycol dimethyl acrylate. Hope you understood. Next is in self-cure acrylic resin, the activator is. In self-cure, we know that we need to activate benzyl peroxide. If it was heat acrylic, we will be giving heat from outside. What about the self-cure acrylic? Benzyl peroxide need to be activated by N-dibutyl para-toluene. That is a tertiary amine. So you need to study that also because both the answer have been asked for the question. See here the answer is tertiary amine, right? Next is inadequate pressure application during flasking. So what happens if we are not properly giving adequate pressure? We know that there will be increase in the substance. There will be actual rappage or change in the actual size of the material. That is cause fracture. No, of course, because pressure is not given. Poor quality of color. Color is not at all dependent on the pressure. Causes teeth to be shrunken. So the answer is actually increased vertical dimension. So increased vertical dimension is actually the answer for this question, right? So that was the main important resin that is commonly been asked, like the acrylic resin. So you need to know the difference between heat cure and also light cure resin. Next is actually composite resin. Actually, composite resin will be dealt later also. So I'm just briefing out the main important thing that you need to know in composite resin, right? So of course, composite is actually a combination. Composite means something a combination of two or more material having a chemical interface in between. Very important point that you need to know is composite often undergoes something called as polymerization shrinkage. So whenever we apply composite on the cavity and we light cure, there is shrinkage of the composite taking place. And this is the main reason for the secondary case, micro leakage, sensitivity, etc. And another important thing is the coefficient of thermal expansion. We know that our tooth is having certain coefficient of thermal expansion. Composite, the coefficient is very high, that is 81 into 10 raised to minus 6 per. This is some of the question that is actually continuously being asked in composites. Next is like, the composition of the composite. First of all, we know that there is a continuous phase. There is a continuous phase that is actually called as resin. And inside that, there are small areas called as the filler particles. And this resin as well as the filler particles are actually connected by the coupling agent. So what is resin? Resin we have already studied earlier, the acrylic resin, where methacrylate are there. Similarly, we have something called as methacrylate here also. As I said earlier, this methacrylate is actually mono-functional. It can connect to only one methacrylate, right? So what we did was that we need a newer methacrylate, that was bis-GMA. Bis-GMA is actually bifunctional. It means that it have other functional groups so that more of a cross-linking or more of a bonding taking place. That was the reason why we actually moved from methacrylate to bis-GMA, because bis-GMA is now the most commonly used resinous material, and the filler particles are similar. Silica is the most commonly used and quartz. And coupling agent is a very important question commonly been asked, that is organosilanes. Just remember, it is organosilanes, right? And what is the need of actually fillers? We know that fillers helps in actually, fillers means what? The answer, it is there in the heading itself. Fill the gaps. Where there is gap, there is less strength. So when filler comes inside, they increase the strength. So as I said, silica is used, quartz is used. Quartz makes it very hard. More the filler particles, more the small filler particles, the polymerization shrinkage will be less. Very important question. Filler particles is inversely proportional to polymerization shrinkage. If we have small particles in between, there will be no shrinkage because the material is there inside. So it prevents the polymerization shrinkage. 1 point. Talking about coupling agent. Coupling agent, as I said, it is organosilanes. Organosilanes have two linking process. One is covalent link, other is radicular copolymerization. Just memorize this chart. Organosilanes is a coupling agent. They have two parts. Coupling agent covalent link on one side, radicular copolymerization on the other side. Okay. So what does covalent link do? It go and attach the filler on one side. The coupling agent on the other side go and attach to the resin matrix. So simple. Just memorize this chart. Okay. Coupling agent, organocelates, covalent to the filler particles, radical copolymerization to the resin matrix. Hope you understood. So this I have already actually talked earlier. Again, as we said in the acrylic also, here also we have the same substances, that is chemically activated resins and light activated. Chemically activated already we know. To activate the benzyl peroxide, what we need, there is a need of a tertiary amine. The tertiary amine is actually toluidine. It is actually para-toluidine is actually the tertiary amine. You can memorize it ABC here also. C is actually the chemically activated thing. And B is actually the benzyl peroxide which need to be get activated. A is actually the amine, that is the tertiary amine which is actually required for activating benzyl peroxide. This benzyl peroxide give free radical for the reaction to take place. Hope you understood. Next is something called as light activated resin. That is what we commonly do, light activation. There is something called as camphoraquinones and actually the light that is responsible for the activation. So light, there will be camphoraquinones present by 0.1 percentage. The initiator is again benzoin methyl ether. Okay, early actually UV lights were used. Nowadays it is replaced by visible light because UV light have lot of problems like retinal damage, etc. And the depth of curing. Depth of curing means in a cavity we will be placing composite. When we apply the light from the source, so what happens is like how much depth into the restoration we have placed, will it penetrate and cause the curing? Right. That is actually the depth of penetration. So the depth of penetration for UV lights is actually not up to the level, that is about 1.5 mm. But in the case of visible light, it is about 2 mm. Next is, this is the differences that you have to keep in mind, especially UV lights, visible lights. So UV light causes retinal damage. It is visible light, not injurious. Depth of cure is 1.5 mm. Depth of cure is 2 mm. And this is another important. We know that there is a wavelength of light which is required for activating the camphoraquinone. Camphoraquinone is a like light-seeking material. It need you can apply various wavelengths of light like 100 nanometer, 300 nanometer, 500 nanometer, 600 nanometer, but it need a light of particular wavelength that we have to give to activate the camphoraquinones, right? That is 400 to 480 nanometer is the light that is required for activating camphoraquinones. So visible light unit, again, we need to just give a minimum exposure of 20 seconds. The other case, UV, it need about actually 60 seconds. This is another important difference. And the tip should be within 2 mm of the composite. That is very important point, commonly asked for question. And it can cure up to a depth of 2 mm. We usually keep it in increments. Very important. In this cavity, we usually keep it in increments. And we have to place it for actually 20 seconds at a distance of actually 2 mm from the composite surface. Another important question commonly asked for your NEET MDS is like, what is the amount or the wavelength of light that you need to give for activating the photoactivator camphoraquinone? As I said, it is between 400 to 500, that is 400 to 480, that is 474 nanometer. It comes in blue region. We have a lot of region like orange, blue, dark blue, red, etc. So it comes actually under the blue region. This is a very important question again asked. Another some important like properties that you need to know. First of all, I told about polymerization shrinkage. Second important property is degree of conversion. Degree of conversion. It is a percentage of carbon single bond that carbon-carbon double bond that have been converted to actually carbon single bond. So this is actually called as the degree of conversion. Whenever we actually apply the source of power, there is conversion of the double bond to actually single bond. So that is called as the degree of conversion, right? What is configuration factor? Very important. So degree of conversion, reduced degree of, that is what you need to think. Reduced degree of actually conversion means there will be lowered strength. So degree of conversion more means more of a strength. It is directly proportional, right? Configuration factor, again, we know that it is also called a C factor. Bonded walls by unbonded walls. That is actually the difference. More the C factor, less will be, more will be the polymerization shrinkage. So more the polymerization shrinkage is actually seen whenever we actually apply more, whenever there is a more of a configuration factor. As I said, the normal polymerization shrinkage ranges from 1.5 to 4% within 24 hours after curing. So there are various methods how we can actually reduce the polymerization shrinkage. That is, one is the incremental technique which we place. We can actually do a bulk filling or an incremental technique, but incremental technique of composite have actually showed to actually reduce the polymerization shrinkage. One, curing techniques are there. We used to do a single stretch like curing of 15 seconds. There are various type of curing like soft start curing, ramped curing, delayed curing, pulse curing. These are the type of curing where the intensity of the light is changed. Like we'll be starting from 150 nanometer of light to actually 300 nanometers of light. There will be shift in the intensity of light. So these are the methods how we reduce the polymerization shrinkage. Soft start curing, ramped curing, delayed curing, pulse curing. There is change in the intensities of light which we give. Next is the placement technique. As I said, there is incremental technique which we use. That is, this is a cavity. We'll be applying composite like this. This is called as actually the vertical technique, and we have actually the horizontal technique is there. We have three. Oblique layering technique means within the cavity we'll be actually giving the composite in actually various oblique pattern. Three-side technique means from three sides we'll be applying the composite and curing in three this thing. And successive cusp buildup means instead of pushing the composite entirely into the cavity, if this is the cusp that we need to actually build up, first of all, we'll be actually building this cusp, then curing. Next, this cusp, curing. This means that the amount of shrinkage will be less in all these techniques. Next is the adhesion that you need to know. First of all, talking about enamel adhesion. So we know that for applying composite, we need to apply phosphoric acid. That is, first of all, etchant has to be applied, followed by bonding agent. Etchant, why we apply etchant? Etchant is actually used to increase the surface energy, so that it can actually, so that the composite can move deeply into the enamel, right? Early in 1955, Bunocore, what he did was that he actually used phosphoric acid for etching the enamel. So enamel, there was actually small micro tags that was actually formed, and into that the composite actually moved to a depth of 10 micrometer to 40 micrometer. That is, enamel, initially Bunocore actually brought phosphoric acid and he etched that so that there is small areas of microtag formation. So etching pattern was of three types. This was actually given by Silverstone. One is like dissolution of the prism core without involvement of the, so this is actually the prism. The prism core will get actually dissoluted, but the core will be get dissolution. So without involving the periphery will be actually preserved as such. Type 2, the prism peripheral area is actually dissolved, but the core is actually intact. Just the opposite. Study 1. The first one is actually the core is actually dissolution take place. The periphery actually sits as such. The second, just the opposite. Third, less distinct, everything will go. So this is actually the pattern of etching of enamel, right? Next is talking about bonding agent. Again, Bunocore bought 30 to 40% of phosphoric acid, and later he concentrated to 37% of phosphoric acid. What happens when we used more than 40% of phosphoric acid? The calcium, it actually forms a salt called as monocalcium phosphate monohydrate. This is very important. Monocalcium phosphate monohydrate. So this is, just think mono. Mono is actually formed above 40%. Less than 27%, it is dicalcium. So this is actually the difference between the salts that is actually formed. That is, if it is actually less than 40%, if it is more than 40%, mono is formed. What happens if it is less than 27%? It is disalts are formed. So these salts, what it causes, like it get attached to the tooth surface. When it get attached to the tooth surface, proper bonding doesn't take place. But these two salts is not formed when the concentration of phosphoric acid is at 37%. Hope you understood. So first was about enamel etching, second is about dentine etching. Now what is conditioning? So when we actually cut the tooth surface, when we actually prepare the cavity, there is smear layer that is actually formed on the cavity. That is, there is a small smear layer that is formed on the cavity, which actually prevents the composite adherence to the enamel and dentine surface. So what we did was that we used very mild acids like organic acids or citric acids, etc., to remove the smear layer, and it doesn't provide that mineralization as that which is produced by the phosphoric acid. So that is called as a conditioner. Hope you understood. So what is a primer? Next, see the cavity inside this. We'll be doing a etching. We'll be washing it out. And after that, we'll be applying a bonding agent. And on top of that, we'll be actually applying a composite. Bonding agent is there. So what was the confusion was like, enamel or the dentine is actually hydrophilic in nature. Means what? There is water present in the enamel and dentine, right? Water is present in enamel and dentine. What about the composite? The composite is hydrophobic, that is water repellent. So the two different environments is being created. One is like water loving enamel and dentine. The other side, there is water repellent or water hating composite. So there should be a molecule in between the composite and the tooth called as a bifunctional monomer, which can hold these two materials together. That is actually a primer. Hope you understood. Primer, as the name suggests, is a bifunctional monomer that attach one side to the water-loving enamel and dentine, and the other side it get actually attached to the composite. Now we need to know the main difference between each generations of composite. The first generation, what happened is like, it chelate with is actually the calcium in dentine, and it does not have much of a bond strength. That is, much of depth of penetration of the composite was not seen. It just chelated with the calcium. That made it to a low bond strength of 2 to 3 MPa. The second generation, like the agent was phosphate ester, and it showed a polar interaction between the phosphate within the second generation is negatively charged between negatively charged phosphate group in resin and the positively charged calcium. So it have a calcium, the calcium is positively charged, it get attached to the positively charged calcium. But it also had, even though the bond strength was more than first generation, but it was not up to the first generation. So it have a low bond strength again of 1 to 5 MPa. Third generation, people started thinking that the smear layer is acting as a hindrance in between the composite and also the tooth. So we need to, in the third generation, they didn't completely remove the bond, the smear layer. They just modified the smear layer. Modification is done with what? Conditioners. Conditioners just modify with smear layer. So from here, we used conditioners. The first case only etching and the composite was actually used. Here we use conditioning and we used primer. Primer means the two-handed person who can actually attach to the composite on one side, enamel on the other side, and then added the bonding agent and then the composite, right? Here, just modification of smear layer was done. Fourth generation started a total etch. The name itself suggests total etch technique. where we'll be etching enamel as well as dentine. So what happens is like there is complete removal. That is the term, complete removal of smear layer. We'll be adding again the primer, bonding agent, and the composite. Hope you understood. Hybrid layer concept actually came in this generation. What is hybrid layer? So we know that the dentine actually consists of collagens, calcium, phosphate, etc. So what happens is like when we actually etch the enamel and dentine, there is spaces that is created, and into the spaces, when we apply composite, the composite go into the spaces between this collagen. So there is a layer that is actually formed by all the collagen particles, the resin materials, etc. form a layer that is actually called as a hybrid layer. Okay. Fifth generation, very easy, 2-bottle system. You just study it as first bottle E, second bottle PA. Simple. Sixth generation, this EP came together. Etchant and primer came together. Adhesive on another bottle. It is actually the bottle system. So bottle 1 is the etchant. Only the etchant was there. Bottle 2, the primer and the adhesive. That is a bonding agent was there. The sixth generation is like bottle 1 is like etchant and primer was there. Bottle 2 is the adhesive or the bonding agent was there. Seventh generation, everything was in a single bottle. So there was need of no mixing, right? These are some of the terms or some of the authors who actually developed or the names you need to memorize when you prepare for NEET MDS. Acid etching was by Bunocore. Hybrid zone, which I have explained earlier, is by Nakabayashi. This GMA resin was introduced by Bhavan. So now let us deal some of the questions. What is the approximate stress that is caused by polymerization shrinkage? So as I said, there will be about 4% of polymerization shrinkage. It produces certain stress. That value you need to know, that is 15 MPa. Second question, what is when the concentration of etchant is more than 50% or more than 40%? As I said, more means monocalcium. Less means it is like the dicalcium. Slow or soft polymerization in seed. As I said, with what there are various light units that we use for actually bringing about the methods which we used to reduce the polymerization shrinkage. As I've explained earlier, soft start polymerization is actually we apply it with the help of a quartz tungsten halogen light unit. Since I have not explained there, I have bring out this question to make you aware. See this answer. So what is soft start or ramped curing? As I said, there will be change in the intensity of light that is used. See here, curing light is used initially with low intensity light of 400 millivolt, and after that it is increased to 800 milliwatt. Hope you understood. So lower the curing initially. As the time passes, we will be increasing the curing quantity. So what happens is like the amount of polymerization shrinkage will be less. It is often done with the help of quartz light. Hope you understand about ramped light and soft curing. Next is the purpose of acid etching prior to composite restoration is, of course, one is like, there's two answers for this. There is removal of smear layer, one, and to produce irregular surfaces. So these two are the answer for the purpose of acid etching prior to the composite application. Now, while working with dental materials, the factor C is associated with. What is factor C? As I said, it is actually the configuration factor. Of course, it is directly proportional to, it is actually related to actually the polymerization shrinkage. So when you actually, this is actually the brief idea about composite. Whenever you do or read on composite, first of all, you need to study on the compositions, especially organocelanes. I have given a beautiful chart, just memorize that. The filler particles, the resin particles, etc. on one side. Classification is also important, microfilled, nanofilled. Normally, nanofilled and hybrid composites are commonly being used nowadays. And then coming to certain important properties like degree of conversion, polymerization shrinkage, various methods to reduce the polymerization shrinkage, like the curing techniques, like soft start means we'll be starting from 400, we'll be raising to 800, and various increment techniques. All these you need to know. And about the etchants, what is the difference between primers, conditioners? Just don't go in depth on like various bonding agents. Just know what is the difference. We can use that code for actually memorizing each generations. And so like to brief out, keep on like reading on the synopsis part of NEET MDS, your textbook pulse, and also like start hearing this video recurrently or continue it along with your reading. Then it will be actually more useful. So hope you had a great time with this PPT and my lecture. If any doubt, you can contact with our Idento site. Thank you. Do enroll. Have a very nice day. Thank you.